Hello, my name is Dr. Chris Bowren. I would like to talk to you today about the proper use of blood sugar monitoring equipment in patients with diabetes. Diabetes is a significant illness affecting many persons in the United States. Immigrant and refugee populations in the United States experience increasing risk of developing diabetes as their length of residence in the United States increases. Without proper treatment, diabetes can lead to medical complications including heart disease, kidney failure, stroke, problems with vision, painful nerve damage, and challenging skin infections which could lead to amputation. Proper treatment of diabetes includes close monitoring of blood sugar levels. Blood sugar monitoring equipment should only be used by one person. The sharing of these devices between multiple persons has been shown to increase the risk of transmitting blood diseases such as hepatitis B. This is why in 2010, the CDC has advised against sharing these devices between multiple persons. Unsafe blood sugar testing practices that have contributed to transmission of hepatitis B include using the same fingerstick device for more than one person, using the same blood glucose meter for more than one person without cleaning and disinfecting it between uses, using the same insulin pen for more than one person, failing to change gloves and perform hand hygiene between fingerstick procedures. Although sharing multiple-use insulin pens can transmit blood-borne infections as well, we will focus this presentation only on the use of blood sugar monitoring equipment. First, let us talk about the fingerstick devices. Fingerstick devices have been used to prick the skin and obtain drops of blood for testing. There are two main types of fingerstick devices. Those that are designed for multiple uses on a single person, and those that are single-use only. These single-use devices are not linked to disease transmission as they can only be used for one fingerstick and then thrown away. Now let's talk about multiple-use devices and why these devices can be risky if used improperly. There are many different kinds of multiple-use devices as shown here. They all are designed to check the blood sugar of a single person multiple times. Let's take a closer look at how these multiple-use fingerstick devices work. The main parts of each device include a plastic casing on the outside, a needle used to puncture the skin, a spring-loaded cradle into which the needle is placed, a safety cap with a hole through which the needle can be propelled. A new sterile needle is replaced after each use. Cleaning the plastic parts of the devices between uses is difficult. Transmission of blood diseases, like hepatitis B, has been linked to this difficulty in cleaning the devices, even with placement of a new sterile needle. Thus, the CDC recommends that these devices never be used for more than one person. Never share these devices, even between your own family members. Blood glucose meters are devices that measure blood glucose levels. The blood is placed on the disposable test strip. The test strip is inserted into the machine until the glucose reading appears. Then the strip is removed. Whenever possible, blood glucose meters should be assigned to one individual person and not be shared. If any blood glucose meters must be shared, the device should be cleaned and disinfected after every use per the manufacturer's instructions to prevent transmission of blood diseases. If the manufacturer does not specify how the device should be cleaned, then it should not be shared. In summary, always remember, 1 needle, 1 lancing device, 1 meter, 1 person. Thank you for listening, and may you be blessed with good health.